I'm Dr. Malia Jensen. We'll get started here in a minute. And today, I think we're going to blow up a little bit of the cholesterol narrative, and we're going to talk about LDL. We're going to talk about the need for medications. You guys, I'm Dr. Malia Jensen, and this is my co-host from heaven. This is Tucker. So, all right, we'll get started here. We're waiting for everybody to gather up. Those of you who are on YouTube, please hit the thumbs up right away so we can get that going. Also, I am live on Instagram and on YouTube. So for those of you who are on Instagram, I do have a live fundraiser for rescue, rehab, and rehome. It's a local rescue where I'm at around Des Moines, Iowa, and they help to rescue dogs that are in kill states and bring them obviously to Iowa, not a kill state. Sorry, guys. A little bit of sore throat this morning, but we'll get through this. We want to talk about cholesterol again today. But anyway, the ones that are on Instagram, you'll see that live fundraiser, and it is legit. So I have been getting, I check once every couple of weeks to every month, unless somebody asks me to contact them to make sure that they got the donation. Remember on Instagram that it first goes through Meta, and then Meta pays um, the rescue or whoever you do a fundraiser for once a month, and usually. So for the month of May, this one ends in 10 days. This live fundraiser, it ends in 10 days. And at the end of 10 days, then Meta sends the rescue the money. And I usually confirm with them once a month that they are receiving that. So I am checking up on it. So we'll get started here. This is an opportunity for you guys to ask questions. If you have a question, please put a Q in front of it so I know that it's not just a comment, but an actual question. And today, like I said, we're going to talk about why conventional medicine says high cholesterol is usually an overproduction by a liver that's gone rogue and pumping out a bunch of LDL, making too much fat. Or that the person is eating way too many eggs or ribeyes. So that is conventional medicine, either a rogue liver overproducing cholesterol, LDL, or the person's just completely eating way too much saturated fat. We're going to put uh, an exclamation point on these things because I think in reality, it's almost always a clearance problem. The liver is producing a normal amount, but it cannot pull the particles back out of the blood due to the breakdown or the lack of function of the LDL receptor on the hepatocytes, on the liver cells. That's where we're going to go today. And so if you have a question, just put a Q in front of it. If you are listening on YouTube right now, can you hit the thumbs up? Just do it right away so we can clear that. But I'm going to try to remind you throughout. Just hit the thumbs up and we'll get going here. Let's first mention familial hyperlipidemia. You guys have probably been told that you have a family history of high cholesterol, but you guys are actually taking it literally. You may not have the actual FH, familial hypercholesterolemia. Familial hypercholesterolemia is a condition where the LDLR, the receptor, well, let's back up. FH is a broken gene. Let's just be honest. It's a broken gene with the LDL receptor gone bad, or the ApoB gene gone bad, or the PCSK9 gene gone bad. Now, you can check each one of those. So can you check for FH, familial hyperlipidemia? Yes. You can check a lipid sequencing test. Now, I had a client tell me that Boston Heart Diagnostics is no longer doing their lipid sequence test. However, lipid next generation sequencing, NGS, is a genetic panel that can be done, okay? So we need to look into who is doing that. I believe Quest does it, but it's something to look into. So it's a lipid sequencing test. FH is either heterozygous, where 50% fewer working receptors are on the liver hepatocells. Yeah, I got some sort of a hot respiratory virus with a major tickle. Yeah, 3 or 4 days ago. And no, I wasn't on a ship recently, so that's probably not it, unless it traveled to Iowa via the airwaves. I'm guessing it came through the Wi-Fi fibers. Right. Okay, so if you're heterozygous for FH, 50% of your LDL receptors on the hepatocytes are either they're not there or they're just not working. If you have homozygous FH, I've never seen it. It's 1 in a million people who have it. Okay. 1 in a million are homozygous for this. 0% of your receptors are working. You guys, this is a problem. Yeah, Sharif, I will. I feel okay. It's just that I got this tickle cough, and it's, as you can see, it's pretty wet. And no, Melanie, I haven't been sick since 2020. It might have been 2021. I can't remember. You know what? It was 2021. That was the last time I've been sick. So, when you are not sick for that long and you come across something, virus, bacterial, fungus, parasite, whatever it is, because your immune system has been basically hibernating because it wasn't needed, when you do come across something, whoa, the immune system goes into overdrive. And I think that's probably what's going on. Now, that cough or that sneeze or that runny nose is actually the body's response to getting rid of it. So, yes, the cough is actually a good thing because our body works by getting rid of that sputum and by coughing. And it also by our runny nose or sneezing to get out. So you don't want to suppress those things. That's why I never give people medications for that. So with FH, let's go back. We're going to talk about familial hyperlipidemia, hypercholesterolemia, however you want to say it. The liver has a clearance problem. The LDL receptors are not working or they're diminished in number. You need those LDL receptors to take the LDL particles back out of the bloodstream. Okay, that is one way that we have a clearance problem. Another thing is something that I refer to as a hyperabsorber. A hyperabsorber has an overactive transport system, a receptor in our small intestine, in our gut. It's called the NPC1L1 receptor. Okay. If you have a hyperactive NPC1L1, thank you, Lucy. I appreciate that. Lucy just sent me a super sticker, a gift. So I appreciate that, Lucy. And I appreciate you being our moderator on YouTube. That is awesome. So Lucy helps me out. She has a blue shield. If you have a question and she sees it and she responds back to you, pretty much what I say, she says. So take it that Lucy knows how to answer your question. And if she doesn't, she'll let me know. Okay. So hyperabsorbers. These people have an overactive NPC1L1 receptor, and it's like a vacuum cleaner. So when we are trying to get rid of our LDL cholesterol through our bowel movements, it goes out through our gut. If we have an overactive NPC1L1 transporter, that guy is sucking up all the LDLs out of the bowel that should be going out into your bowel movement. So then it recirculates back into the bloodstream. So how can you tell whether you are a hyperabsorber or you're overproducing LDL in the liver? Remember, most people are not overproducers. they have a problem with clearance, the clearance problem of the LDL. So if you were looking, how would you know whether you are a hyperabsorber or an overproducer? Because I think if you have a high LDL, you need to know what your diagnosis is. Okay. Good morning, Cameron. Don't just blindly say high LDL and then listen to your doctor and take a medication. Okay. That you need to know your diagnosis because they might be picking the wrong medication. And I'll explain that. The way you can tell whether or not you're a hyperabsorber, meaning you have a hyperactive NPC1L1 receptor, sucking vacuuming up all of the LDL out of your bowel instead of pooping it out, or are you an overproducer? The test is called a cholesterol balance test. Okay. A cholesterol balance test can be done at Boston Heart Diagnostics. It's called a cholesterol balance test. I also believe that um, this is Buddy. Buddy was my birthday present, and yeah, Buddy was adopted from rescue, rehab, and rehome. Yes, so that's why I'm very passionate about this. This fun, this. Okay, you lay down, Buddy. That's why I'm passionate about this particular rehab rescue. So if you guys want to donate to them, there's a reason that I have chosen this particular rescue. Okay, Buddy in 28 days might have been sent to death row, and he got saved. He was a surrender, a family surrender. For some reason, I'm not sure why. We'll never know why that his family surrendered him. But he might have been sick. He does have a heart murmur. He appears to have never been outside. Apparently, he has used a puppy pad because he's not potty trained yet. So we're working on that. But it's only been 10 days, and he's doing very well, accommodating. So yeah, so you see his little head popping up. He is not taking Tucker's place, but I think that he might, over time, learn the ropes that Tucker knew very well for nearly 17 years. And this little guy is only 2. I'm not sure that I will be doing this for 15 more years, but you never know. Okay. So getting back to this test that I think people should take is a cholesterol balance test. And yeah, likely you will have to pay for it out of your own pocket through Boston Heart Diagnostics or through Quest or LabCorp. Look into it. Okay, guys. So simply before, yeah, yes, 1910, I did. He's he is. I'll just show you him. He's he's a little guy. He's about 8 pounds of pure dachshund. And yeah, he's got a little belly band on because he's not potty trained. So yeah, he was my birthday present. And I wasn't looking, but Rescue, Rehab, and Rehome contacted me, and because they knew that I love dachshunds. And so that's how Buddy came into our life. So he was a birthday present. Sorry for the interruptions. We'll get back to this cholesterol balance test. Without knowing what your diagnosis is, you got high LDL, just get the test. If you are a hyperabsorber, you're going to have a high sitosterol and a high camposterol, those two markers. If you're an overproducer, you're going to have a high desmosterol and a high lathosterol, LATHO sterol, STEROL. Okay. If you are a hyperabsorber, you for sure do not want to take a statin. Here's why. Sorry, guys. If you have hyperactive NPC1L1 receptors in your lumen of your gut, gosh, the tickle is unbelievable. And I don't have water. You can tell I've never been sick for a while. All right. So if you take, oh my goodness, I'll get through this. Just bear with me, you guys. Cough begets cough. So we're going to try to suppress it for a second here. Okay. If you're a hyperabsorber, you do a cholesterol balance test and you have high sitosterol and high camposterol, and you give a statin, the statin shuts down production of cholesterol by the liver. When you do that, you are actually turning off cholesterol production in the liver, and you are in a hyperabsorber that starves the hepatocyte of necessary cholesterol. I know it sounds crazy, but if you shut off the production of cholesterol in the liver, the hepatocytes need cholesterol, so they're not getting any cholesterol. Okay. And so this starves them. And because statins block CoQ10, remember, statins block the mevalonate pathway. Along the mevalonate pathway, if you block it, you don't get CoQ10, you don't get vitamin D, you don't get vitamin K, you don't get your sex hormones, you don't get a lot of things when you block cholesterol production in the liver. Another thing, statins are useless in a hyperabsorber. In fact, if you're a hyperabsorber and you go on a statin, guess what's going to happen to your LDL? It's going to go up because statins are blocking the production. You do not have a production problem. You have an absorption problem. You are hyperabsorbing LDL, and statins don't block the NPC1L1 receptor. Make sense? So you will continue to vacuum up the LDLs out of your body, out of the gut lumen, and your LDL is going to go up despite being on a statin because statins block production. You do not have a production problem. Make sense? If you are an overproducer, the reason why you wouldn't use a statin, another reason why you wouldn't use a statin, is that this overproduction by your liver, the number one cause of being an overproducer is high insulin, insulin resistance, fructose consumption, alcohol consumption. If you have fatty liver, you could be considered an overproducer. Thanks, Chelsea. Insulin and fructose and alcohol switch on a master fat building gene. Do you want to know the name? You'll never remember it. SREBP-1C. Doesn't make a difference. So when you want it down, yeah, he may be back. He may be back. When you have insulin resistance, you're going to build up fat in your liver. Do you necessarily want to give a statin to block the production of LDL cholesterol when the best option is to get rid of your insulin resistance? That's what my thoughts are. You see, doctors want to treat a number on a lab sheet, and they don't know or they don't care of what your diagnosis is. Remember, I'm talking to the people over the last 2 weeks that have cholesterol in the 200s and even 300, okay? These people are just blindly being put on a statin. I have one person who had an LDL in the 150s, and they're on 3 medications, you guys. They're on a statin, they're on a PCSK9 inhibitor, and they are on Zetia for a 150 something LDL. Now their LDL is 69. What was the reasoning for putting that person on 3 medications without knowing the diagnosis? We're just going to hit you from all angles because you have a family history. We don't know if you had FH, if you were a hyperabsorber, if you were an overproducer, if you had nothing. This is where I think conventional medicine has gone way wrong by treating a number on a piece of paper. Can you just stop taking it? Of course, you can stop taking a cholesterol medication. However, should you talk to your doctor about it? I mean, this is for information purposes only, okay? But is there a danger to stopping a cholesterol medicine? There could be. You could get a rebound. I mean, with a statin, you guys, what would be a reason for taking a statin? What good thing is there about a statin? There's probably 2 things. It is supposedly anti-inflammatory. It is supposedly antithrombotic. Anti-inflammatory, antithrombotic are the 2 positive things. If they are real, those are the 2 positive things. If you've been on a statin for years, say 20 years, and you just stop it, is it possible you could get a rebound blood clot? It is possible. Okay. Especially if you have high LP little a, or you have a blood clot disorder like factor 8, high fibrinogen, factor 5, prothrombin mutation. What if you have high hemoglobin and hematocrit? What if you're on testosterone and you happen to just stop your statin? You could get all of that as a problem. You could get all of that could cause a rebound blood clot by just stopping a statin. So what should you really do? You probably should wean off of it slowly. So that's why I suggest talking to your doctor. But good question. I appreciate that. Um, Cheesehead says, my son graduated from high school. In-laws are up visiting. We'll watch replay later. Thanks again for all of your information. Thank you for being here. I appreciate that. Make sure I don't have any other questions. Here's Dunaway says, Darnell says, I have a triglyceride of 113. The goal is less than 70. Have an HDL of 76. Goal is above 70. An LDL of 183. ApoB of 130. What now? EKG shows paroxysmal atrial, I'm guessing you meant fibrillation, not tachycardia. So you have intermittent AFib. You have high triglycerides compared to HDL. So it's still less than 2. Darnell, you have a bit of a paradoxical conundrum. Usually with a higher triglyceride, you're going to be even lower HDL. Okay. So you have actually high HDL, a good thing, with a triglyceride that's a little elevated. And you have an EKG that showed intermittent AFib. Darnell, there is a strong possibility that you have blockages in your arteries. I cannot, with 100% confidence, tell you you do, but usually people who have been building up, and I'm guessing you're in you're over your 50s, okay? I'm guessing you are in your 60s or 70s, and you have been probably developing coronary artery disease, plaquing in your arteries for years. And you have now developed an arrhythmia. Again, I can't prove it, but I suggest to you to look into a CT angiogram with Clearly. A CT angiogram with Clearly. It's an AI software that evaluates your CT angiogram. It's only done at certain locations. It will tell you the volume of your soft plaque and your hard plaque. If you just got a CAC score and it's over 0, it doesn't tell you anything about your soft plaque. And if you are older, your risk of having coronary artery disease is very high. I would also find out with your LDL of 183, are you an absorber, hyperabsorber, or are you an overproducer? Only for your information, okay? Because it will determine if you're going to go on a medication, what medication are you going to do? If you are a hyperabsorber, again, I don't think that a statin is in your best interest. I think Zetia would be in your best interest, okay? All right. Good. You guys are having some audio problems or not audio problems? Thomas says he did a calcium scoring test and it was 0. That's awesome. Keith, I'm not sure what is causing your chest pain, but it does need to be looked at, okay? Okay. Chelsea, can you, I will get to that question, but can you, I just want to get through this cholesterol problem because I think it is, and I'm glad that Darnell brought up his labs because we're not, I don't believe that doctors are thinking through everything, okay? And we need to be, I think knowing a diagnosis is very important. KK says, my son had a heart attack a month ago or 2, and they put a stent in. So he's taking blood thinners, and also he's gained a ton of weight. So, KK, it's quite possible that your son has been insulin resistant for 10 or more years, maybe even diabetic, and no one looked. He's probably got fatty liver disease. Okay. And that fatty liver disease and that hyperinsulinemia, which is from hypersugar anemia, has caused his plaquing to accelerate. If he had a stent, it will take upwards to 6 to 12 months for that stent to incorporate itself into that artery. He is at very high risk of having a re-blockage at the ends of that stent because that's where scarring occurs. But it takes quite a long time for that stent to incorporate itself into the lining of that artery. It gets enmeshed in it. So that's why he's on a blood thinner. they usually put people on a statin, not so much maybe to lower the LDL, but to be antithrombotic and anti-inflammatory. That would be a reason for using a statin. Now, if he has insulin resistance, his inflammation isn't coming from a deficiency of a statin. It's coming from hyperinsulinemia. So he needs to, and again, KK, I don't know his diagnosis, okay? You're bringing this up. I am speculating at best that he's got fatty liver, which is that fat is highly thrombotic. Fat around the liver releases hormones, and one of those hormones is called PAI-1, plasminogen plasminogen activator inhibitor 1. It is highly thrombotic. Okay. So we're trying to block blood clots from breaking off and going downstream and causing heart attacks and strokes. But that your son needing a stent is from years of building up plaque. Okay. Years of building up plaque. And so he's been, I don't know how old he is, but he's probably been, eating bad for a lot of years. With age, I also don't know his LDL status. I don't know his triglycerides, his HDL. So that's just what I've come up with your scenario. Yes, Darnell is 76. So I kind of predicted correctly that, over time with coronary artery disease, you develop arrhythmias. This also is common in people who are runners or do extensive exercise. And so I don't know if that's you either, but yeah, AFib or congestive heart failure is very common. Okay, we just went off on Instagram. The live video ended. Shoot. All right, we'll wait for them to come back on. Lucy says, so if you're not going to take a cholesterol medication, you don't really need to find out if you're an absorber or not. Yes, you do. Lucy, let's talk about that scenario. If you're a hyperabsorber, your LDL is going to be 300, 400. It'll look like FH. It'll look like familial hyperlipidemia. Why should you know? Because anytime you have high LDLs in your bloodstream and they are not, and there's so many of them that they're not being taken back up by the liver, they can collide with VLDLs and they can cause small dense LDLs. I know this is kind of complicated, but I'm going to try to make it as simple as possible. Every LDL starts out as a VLDL. The liver packages up cholesterol and fat and triglycerides in a VLDL and sends that out into the bloodstream. And the VLDL dumps off its cargo, the triglycerides, to tissues and cells and muscle that need the triglycerides as fuel. Once it dumps off cargo, it becomes smaller. It becomes an intermediate density lipoprotein. And when that IDL dumps off some of its cargo, it becomes a low density lipoprotein. Now, once it becomes an LDL, it dumps off some of cholesterol to cell membranes that need it. And then that LDL is supposed to circulate back to the liver, attach to an LDL receptor, and be incorporated into the liver to either be reused or our bile in our bowel movement. That is a normal process. If you're a hyperabsorber in your scenario, your body, as the liver was dumping the LDLs out into the bloodstream, your hyperactive NPC1L1 receptor is vacuuming up all the LDL that was supposed to go out as poop, right? It gets recirculated back into the bloodstream. Now you have an overload of LDLs in the bloodstream. Why is this bad? Because the liver is still packaging up VLDL and sending it out into the bloodstream. Those VLDLs bump into all of the LDLs. That collision, this process of VLDLs giving the LDLs back some triglycerides is dangerous. An LDL is never supposed to have triglycerides in it, only a VLDL. But if there's so many LDLs in your bloodstream, they can't avoid being hit by the VLDLs being produced by your liver. This process exchanges VLDL triglycerides into the LDL, making them very dangerous. They can now be oxidized because in this exchange, VLDLs take the LDL's cholesterol. Now the LDL is essentially naked. He doesn't have any cholesterol protecting him, so he can get oxidized. Now he can shrivel up and become a small, dense LDL. Not good. So anytime in the bloodstream, when there's a ton of LDLs, and your liver is still pumping out VLDLs, which is very common. Even more VLDLs are being pumped out if the person has fatty liver. What if they have fatty liver and a hyperabsorber? So back to your question, if you're not going to take medications and you know you're a hyperabsorber, what can you do? You could increase your fiber. The fiber will bind to the cholesterol and get it out into the poop before the NPC 1L1 can vacuum it up. But if you're a hyperabsorber, Lucy, this is one time where if I found out I was a hyperabsorber and my LDL was 300, I think this is one instance where I would take Zetia. Just because what I know, there's not enough fiber that could shut down that NPC1L1 receptor. And I would risk having a ton of LDLs in my bloodstream bumping into my VLDLs. Now, you could say that, Dr. Jensen, you're healthy. Ah, geez, we just lost connection on Instagram again. Let me see. Let's close everything and we'll just go back on. These Instagrammers are probably not going to want to be with me. So we'll jump back on. So Lucia, hopefully you can understand where a hyperabsorber in the presence of a fatty liver could really be dangerous, okay? Because the fatty liver is trying to get rid of all of the fat, okay? And and if that person has fatty liver and they're a hyperabsorber, that is a bad combination, okay? It's just a bad combination. That person is at risk. So, do you want to come up and say hi? Okay. Okay. Tyler wants to say hi. Go lay down. Go lay down. Okay. All right. So hopefully that answered your question, Lucy. Stan says, should we be taking a daily mineral supplement? That is a great question. This is my overall recommendation in regards to this question. Get your levels checked. Get your copper level checked, your zinc level, get your selenium level checked, get a magnesium, get an iron studies. So serum iron, a ferritin, a transferrin, a TIBC, and a saturation. Get levels first before taking a daily mineral. Is it possible that in today's society that we lack minerals? Absolutely. We probably lack iodine, and we probably lack copper or zinc. We probably have iron all in the wrong spot because we eat crappy diets and we're not absorbing things, okay? Terry says, Jesus Christ loves you and your beautiful soul. Thank you. I know Jesus loves me because I love Jesus. And it's a two-way street. And he saved my life. Okay. Yeah, Teresa, I know Instagram is having some problems, but thank you for being on YouTube. I appreciate it. Hi Dean. Thanks for being here. I appreciate you guys. Lucy says, would you need to take Zetia forever? Yes. Why? Because NPC1L1 is when you're a hyperabsorber, that's a gene defect. So once a gene defect, always a gene defect. You just happen to have been born with hyperactive transporters in your gut called the NPC1L1 transporter. Why he's hyperactive, I don't know. It's a gene mutation, I guess. I haven't really looked into it, okay? Can you advise what I should do for eye swelling tested positive for ANA? You need to find out why your ANA is positive, okay? So yes, you probably do have an autoimmune disease, but you may not. So you really need to have it. Usually they reflex to test for lupus or Sjogren's. Don't fall through the cracks, little guy. Okay? So your rheumatologist will usually look into that, and you should probably look into that. Okay. All right. Oh yeah, yeah. You guys, if you are on YouTube right now, please hit the thumbs up. Just go tap it right now, so I see that you are here. And please subscribe if you have not already. Thank you, Lucy. I appreciate that. Okay. All right. So here's a question about Repatha. So what is Repatha or what is Praluent? These are called PCSK9 inhibitors. What is PCSK9? It is a protein. It is a protein actually produced by our liver, and it's in our bloodstream. Okay. So PCSK9, thank you guys. I can see that you're here now. You're hitting the thumbs up. Um, the PCSK9, its job is to either recycle LDL receptors or completely get rid of them so the liver can make new ones. So let's go back to our normal scenario. Our liver makes VLDL that carries triglycerides and cholesterol and sends it out into the bloodstream where it delivers the cargo to places that need it. It becomes an LDL. LDL dumps off its cholesterol to cell membranes and places where it needs cholesterol in our body. And then the LDL recirculates back to the liver. PCSK9 helps to destroy that LDL receptor after it's done its job or tell the liver to recycle it. All right. That is the job of PCSK9. What if you have overactive PCSK9? Now you are destroying LDL receptors, leaving not enough receptors for all of your LDL that needs to come back and be recycled. That, when you have hyperactive PCSK9, guess what? You have one of the components of familial hyperlipidemia. Familial hypercholesterolemia is either an LDLR problem with an ApoB problem and a PCSK9 problem. So you, back to what you want to test for, you get that genetic profile called the lipid next generation sequencing, the NGS genetic panel, the NGS, Nancy, Greg, Sam panel. Should you give a PCSK9 to these people who have overactive PCSK9. So you're going to give an inhibitor. Let's go back. You have hyperactive PCSK9 destroying your LDL receptors. Should you give a PCSK9 inhibitor that will inhibit the overactive PCSK9 in your blood? Should you do that? So when you give a PCSK9 inhibitor, the LDL receptors will be more active. Now, if you have FH, you already don't have working LDL receptors. By giving a PCSK9 inhibitor, can you actually make more LDL receptors? Doubtful. So in FH, should you give a PCSK9 inhibitor? I don't know the right answer. Could you possibly have FH with low numbers of LDL receptors, give a PCSK9 and more LDL receptors are born? I'm not sure. I'm not sure, but you can see where I'm thinking through this, okay? So maybe you do give a PCSK9 inhibitor and your LDL comes down. That would be the answer, because before the PCSK9 inhibitor, you had high LDL and there wasn't enough receptors to take it all up. So you gave a PCSK9 inhibitor and it inhibited the PCSK9s. So the available LDLs that were there soaked up all the LDLs, or most of them. That would be an option if you had high active, overactive PCSK9 protein in your body. I could see that. What if you had fatty liver with that? Well, how could you get fatty liver? Insulin resistance, hyperinsulinemia. Should you give a PCSK9 to a person who has fatty liver? Why do I ask? Because this fatty liver already has too much fat. If I give you a PCSK9 inhibitor to shut down the PCSK9s that destroy LDLs, you're going to have more LDLs on the liver. So you're going to collect up more LDLs. You're going to drive more fat into the liver. So now you're making a fatty liver even fattier. Do I want to do that? It's a curious question because the drug reps will tell you that PCSK9, even though they allow more LDLs to come back to the liver to lower the LDL in the bloodstream, they don't worsen fatty liver. It seems nearly impossible to me, but here's maybe why. A PCSK9 inhibitor works outside of the hepatocyte. So if you can picture the liver, inside the liver are cells. A PCSK9 inhibitor works outside the cell, not inside the cell. So it's possible that the cell stays healthy, its mitochondria are working to burn the fat in that's built up in the liver. The reason I just don't think that it can keep up is because the person has fatty liver for a reason. They're overeating carbohydrates or seed oils, processed foods, okay? And so their mitochondria are snoozing. So again, I really don't want this is me. This is for information purposes only. This is not medical advice. I probably don't want to take any medicine. I want to fix my fatty liver. If I have fixed my fatty liver and I have familial hyperlipidemia with high PCSK9 activity, I might want to take a PCSK9 inhibitor. I don't know. This is why it is so important to know what your diagnosis is. Because there's some things that you can absolutely fix. And the most common is a fatty liver. You're an overproducer because you have fatty liver. The FH is rare. 1 in 250,000 people. Are you 1 in 250,000 people? Maybe. So we're talking about the zebras here. Yet a doctor is treating everybody across the board with a statin. Is it a zebra to be a hyperabsorber? Not as much as being a FH. So knowing your diagnosis will give you a better idea of how and if you want to treat it. Because if you left a bunch of LDLs in your bloodstream and they're colliding with VLDLs, do you really want to risk having small, dense LDLs, even if you're on a carnivore diet? Even if you're carnivore, get an NMR, get a nuclear magnetic resonance imaging, get advanced lipid tests. See how many small, dense LDLs you have. If you're eating carnivore or keto and you still have a small, dense LDL problem, you guys, look at the liver. Do you have fatty liver? Doubtful because you're on a carnivore diet, but how would you have fatty liver on a carnivore diet? I'm glad you asked. No sleep and stress causes a fatty liver, even though you're eating no sugar. Your body is making it. Your body is responding to stress and no sleep, which is stressful, by cortisol, sugar, insulin, fatty liver. So can you have fatty liver on a carnivore diet? Absolutely. But a lot of people who do a carnivore diet don't think about these things and think that they are not at risk of having a heart attack or stroke. I beg to differ. Get an NMR, and if you got a lot of small, dense LDLs in there, you have a problem. Now, do small, dense LDLs all of a sudden become sticky and stick anywhere on the artery lining? I say no. If you have no injury to the lining of the artery, then your small dense LDLs and your LP little A's and the platelets and the debris and the white blood cells, they don't really have a docking bay to start a clot. But it's possible. If I checked a small dense LDL, even on carnivore diet, and my small dense LDLs are high, I'm going to try to figure out what is causing those small dense LDLs, because they can only get small is if a ton of VLDLs are pumping out and colliding with LDLs and exchanging components. Sugar is usually the most common cause of small dense LDLs, but you can tell that a carnivore is not eating sugar. So, I mean, if they're telling you the truth, they're not eating sugar, but they're stressed. They're not sleeping. Their body is hyper vigilant. They are overactive sympathetic nervous system. They have low parasympathetic nervous system. These carnivores are at risk of a heart attack and stroke, just like somebody eating a standard American diet full of crap. And so I am cautious on telling a carnivore that they're fine. They may not be. And we're in trouble if we let it go. So those carnivore coaches out there, I hope you're listening. You carnivore eaters out there, I hope you're listening. Okay? Now, if you have a high LDL, we talked about testing for FH. We talked about testing for hyperabsorbers. We know why you might not want to take a statin. We know why you might not want to take a PCSK9 inhibitor. We know why you might want to do Zetia. Okay? What else besides FH and hyperabsorber could be causing your high LDL? Thyroid. Last week or the week before, I did reels on thyroid and why thyroid and hypercholesterolemia go hand in hand. And I explained that you could have a normal TSH, all right, and still have low thyroid. Doctors don't know to look for hypothyroidism as a cause of your high LDL because they're only looking at one number. Just how they were blinded only by looking at LDL for cholesterol, they're blinded at looking only at TSH for your thyroid. If you do not get a full panel of a thyroid, TSH, free T3, free T4, TG, TPO, and a reverse T3. If you don't get a full thyroid panel, you could be missing hypothyroid as a cause of your hypercholesterol problem. I had doctors, mainly endocrinologists, tell me that we should never be checking for a reverse T3 on everybody and only check a reverse T3 when you're in the hospital and you're critically ill. I'm looking at reverse T3 as a cause, if it's high, of your high cholesterol, that the doctor is going to treat you with a statin to get your LDL down when they should have checked your thyroid. Okay? If your T3 or T4 is converting to reverse T3 instead of T3, you have no active thyroid that helps with your cholesterol problem in the liver. If you don't look for reverse T3, you may never see that you have a thyroid problem. You could have normal levels, yet your cholesterol is high. And if you checked a reverse T3 and it was over between 12, 13, 14, 15, and above, then your cholesterol problem could be from that. And usually, why do you have high reverse T3? What would cause a conversion of your T4 to reverse T3 instead of T3? Stress, no sleep, high insulin. The very same things that mess up your liver are messing up your thyroid. We have a metabolic problem, you guys. It's metabolic. And yet we are treating way downstream. You don't have a deficiency of a chemical medication. You have overabundance of stress and poor diet. That includes sugar and alcohol and processed foods, and it is messing up the normal biologic and physiologic system in our body. Yes, Angie, so much is metabolic related. You're exactly right. But yet, a doctor will tell you never check a reverse T3 unless you're critically ill. Well, you will be critically ill if you have high cholesterol and you take a statin or a PCSK9 or any other medication. You could be critically ill. To limit a simple check, you have hyperlipidemia. It's over 150, 180, 200, 300. Shouldn't you check a full thyroid panel and get rid of this thought process, this standard of care? The standard of care says you don't need to get a small dense LDL. Just check your LDL. If it's high, take your medicine. No, I want to know if I have small dense LDLs or if I have large buoyant ones. And I want to check a full thyroid panel. Don't tell me that you don't need a reverse T3 if you have high cholesterol. Go lay down. Go lay down. Okay? So get rid of this standard of care BS, okay? No, Brave, I am not. I'm in Iowa, okay? My TSH is low and my thyroid is swollen in my neck for years. So you have a goiter, Brave, or do you have nodules? Are your nodules cold? Are they hot? Have you had that looked into? So if your TSH is low, you could have high T3, you could have high T4, but it could be falsely elevated. Or you could have some sort of thyrotoxicosis. I know it it seems odd, but you need, Brave, a diagnosis, a complete diagnosis. Have you had a thyroid uptake scan? All right. So, you know, there's much to be looked into. Yes, been to the endocrinologist, ultrasound plus blood draw. For everything, Brave, you know all of your. Thank you, Alexa, thank you so much for the super chat. Alexa asks, total cholesterol 283, triglycerides 54, excellent, HDL 95, LDL 173, with a non-HDL of 188. What does non-HDL mean? Okay, let's answer that part. Non-HDL means anything, any lipoprotein but HDL. Okay? It means anything but HDL. It could be VLDL, IDL, LDL, that's triglycerides, that is all non-HDL. Usually, raising non-HDLs is because of high VLDL and triglycerides, but not always. Look at Alexa's panel. Her triglycerides are only 54. So you can assume Alexa has low VLDL. So what is raising Alexa's non-HDL? Obvious, it's her regular LDL or IDL. We don't know what her IDL is. What does Alexa need to do? Alexa needs to figure out what is causing the high LDL of 173. Is Alexa ketogenic? It looks like Alexa is probably eating a ketogenic diet, low carb. I mean, with a triglyceride of 54, you guys. All right. So we're going to assume, because Alexa didn't tell us, that Alexa is eating a very low carb diet. And Alexa could be eating a lot of saturated fat. Alexa could be eating ribeyes and 85% ground beef. And Alexa could be eating eggs, whole eggs. And Alexa could be buttering up everything in tallow and lard and eating bacon and doing all the ketogenic thing. And Alexa could have a problem with saturated fat. Alexa has a body that can't tolerate saturated fat. Too much saturated fat could raise Alexa's LDL. Yes, they could be large and fluffy, and hopefully not small and dense, but we don't know. We would have to get an advanced lipid test. But it's possible. Let's just say Alexa has a problem taking care of all the saturated fat that you are taking in. What could Alexa do? Alexa could decrease some of the saturated fat and increase monounsaturated fat. Alexa could be a lean mass hyperresponder. And simply lowering saturated fat and replacing it with monounsaturated fat, like an avocado. I know it's a plant, but maybe Alexa eats a plant. Maybe Alexa eats macadamia nuts on her diet. Maybe Alexa would do extra virgin real olive oil. Those are monounsaturated. And by going maybe 50-50 monounsaturated to saturated would lower her LDL and bring down the small dense LDLs. That is treating from the hip, okay? That's treating from the hip. We didn't look. We're just going to assume, and we're assuming because we don't even know what Alexa eats. I'm just speculating. But should we look into, is Alexa a hyperabsorber? Or is Alexa an overproducer? Or is Alexa just overdoing saturated fat? We should probably look. Get a cholesterol balance test, Alexa. So, is the numbers concerning? From a 100-foot view or a 100-mile view, according to most metabolic doctors, they would tell you it's not a concern. But I can't leave it. I don't know. And if you get an advanced lipid test and you have a bunch of small, dense LDLs, you are at risk, Alexa, of having a heart attack or stroke, even though you look metabolically wonderful with a triglyceride of 54 and an HDL of 95. I'm guessing your insulin level is between 3 and 5. I don't know, but I'm going to speculate. So on the overall big picture, you look like you're not going to have a problem. But what if you do? And so it needs to be looked into. I'm not saying you need medicine. I'm just saying you might need just a simple shift in your diet. Okay? All right. Brave, I'm not sure if you actually have Graves, it again, I would need to look into it with more lab tests. I can't comment on what's causing it right now. Okay. Marion. Marion says, my lipid panel has a total cholesterol of 316, HDL of 93. Awesome. Triglycerides, 81. Not bad. I mean, I'd like them less than 70, but her ratio is less. 81 divided by 93, 81 trigs divided by 93 HDL is less than 1. That's great. The LDL cholesterol for Marion is 204. It's pretty high, right? According to what we know. Her Marion has a non-HDL of 223. This same thing, this is why I don't just blast Marion with a statin or PCSK9 inhibitor or Zetia or any other cholesterol medicine, because a regular doctor would freak out at these labs. They'll freak out with an LDL of 204 and probably have a heart attack on the spot. But what is the diagnosis? Is Marion have familial hyperlipidemia? Is Marion 1 in 250,000? Likely not, but it's possible. Okay? So get a gene panel for FH. Check if Marion is a hyperabsorber or an overproducer. How? Get a cholesterol balance test. Does Marion with the high LDL have high small dense LDLs? I don't know. Get an advanced lipid test. It's important to know the diagnosis. I can tell you all of these things to get, but you know where you're going to have problems. Your doctor does not want to order these tests. And unfortunately, they won't sign the order for you to pay for it out of your own pocket. Unfortunately, many of these places require a doctor's order to get a genetic lipid sequence panel to see if you have FH. I mean, Marion's got an LDL of 204. Doesn't the doctor want to know if Marion has FH? Or is Marion simply a hyperabsorber. Because honestly, the medication treatment is totally different. Why just get a general band-aid when you can know exactly the diagnosis and know exactly what you need to treat it with, if you need to treat it at all? Is this making sense to you guys? Hit the thumbs up and let me know. Is it making sense of what I'm saying? I'm just trying to connect the dots instead of you being bamboozled and being propagandized by your doctor when you don't even know your diagnosis, and you're being medically gaslit into thinking that you are doomed to die because your LDL is 204. Does it make sense to you that we should know the diagnosis? Because what if Marion just has a thyroid problem? Marion's got a thyroid problem. We don't know. Fix the thyroid and the LDL cholesterol comes down. What if Marion is a menopausal female? Remember, estrogen naturally suppresses PCSK9. You're not going to believe this, but Instagram just went off. I'm sure that won't surprise you. Let me just sign this on again, and we'll let Marion kind of jump back on. Hopefully Marion will jump back on here, and we'll talk a little bit about menopause, because I don't know if Marion is female or if Marion is a female menopausal female. Okay. Thanks, Diane and Details, for coming back on. I appreciate it. We're having some trouble, as usual, with Instagram. If you want to see the full video, please jump on YouTube and find me at Iron Lady Doc, and you can watch the whole thing from start to finish instead of cut and pasting over. Marion is female. Marion is not menopausal. Let's just say Marion was, okay? So we can bring this other feature into it, okay? Marion, just to let you know, I would definitely check your thyroid, full panel, okay, before I jumped into anything. And that you could probably order on your own. Marion, if your doctor will not get a full panel on your thyroid, you're okay. You go lay down, okay? You can order it on your own. Go to ownyourlabs.com and figure out what's going on, okay? So first, check your thyroid. But if you were menopausal, menopause, or excuse me, estrogen. So when you do have estrogen, it is a natural suppressor of PCSK9. Remember, the PCSK9, when it's active, it destroys LDL receptors. So then LDL will go up. If you have less receptors to take up the LDL in your bloodstream will go up. When you have estrogen on board, it naturally keeps your PCSK9 at bay. So it's not destroying all of the LDL receptors. So is it possible that Marion, not being menopause yet, she still has estrogen? Estrogen's keeping the PCSK9 at bay. It's likely not an FH problem. Okay? But for all of you menopausals out there listening right now, when you go menopause, guess what? Your LDL can go up 30 to 50%. Marion, you're 70, so you are postmenopausal. So you don't have estrogen. Mostly don't have estrogen. You do if your adrenals are working. Oh boy, there's another thing to talk about. Let's say Marion is healthy and she's postmenopausal, right? She has low estrogen from her ovaries, but a healthy Marion who's got a strong body will produce the estrogen she needs through the adrenal glands. If Marion is eating enough animal fat and cholesterol. Animal fat and cholesterol makes pregnenolone, and pregnenolone is supposed to tell the adrenal gland to produce DHEA. And then DHEA converts to androstenedione, and androstenedione converts to testosterone, and testosterone converts to estrogen. That's in a healthy adrenal gland. When are your adrenal glands not healthy? Let me guess. Insulin resistance, hyperinsulinemia, stress, no sleep. So, the stressed, hyperinsulinemic, no sleep, menopausal female probably has a high reverse T3 because that's the ingredients, will have high cholesterol. So the doctor naturally will want to put you on, you guessed it, a statin. When all you need to do is continue eating healthy animal fats to make pregnenolone and make sure that the pregnenolone stimulates the adrenal gland. That's working. Instead of producing cortisol because of your stress, no sleep, and I don't know, inflammation. It's usually stress because that's what's going to trigger cortisol. Stress and no sleep. Okay. Hopefully that I think the picture you guys are getting at the moment is there are many reasons for high LDL. FH, which is pretty rare. 1 in 250,000. It's if you're heterozygous. 1 in a million if you're homozygous. That's dangerous. If your LDL is high from FH, okay. What if you're a hyperabsorber? What if you're an overproducer? What if you have a thyroid problem? What if you're menopausal? What if you have high cortisol and inflammation? All of this needs to be looked into. And you guys need to be educated. And yeah, you probably need to teach your family practice doctor or whatever doctor, okay? Your PCP. The problem arises when your doctor does not want to do anything. And now you have to reach outside of the box and try to get these tests ordered on your own. So you have to hire a doctor who has a license in your state. Now, I don't have a license in every state. I am licensed only in Iowa. Some doctors have license in every state, and they can write any order. I cannot. I can order in some states blood work, but guess what? On the lab I use, they can't do a cholesterol balance or an FH gene panel. Maybe someday they will, and that would make me very happy. But you see, at the lab I use, they have a medical director that has a license in every state. And so basically, if I put the order in, that medical director will okay it. And then I don't have to worry about getting licensed in every state. But maybe, just maybe, you guys can find a doctor in your state that will sign the order for the lipid next generation sequencing to check for FH. Maybe they will sign the order for the cholesterol balance test, and maybe, just maybe, they will um, get a full thyroid panel on you. The full thyroid panel, the TSH, the free T3, the free T4, the TG, TPO, and reverse T3. The whole 9 yards. Just maybe they will do that. It's tough, you guys. I get it. I can't answer why a doctor doesn't want to look into things. I can speculate and say they're lazy. I can speculate and say they have a condition of ignorosis, meaning a condition of ignorance. I could speculate that if they order certain tests when they are not standard of care, they get deductions in their pay, and they don't want to risk their pay over finding out what's really wrong with you. So, do you really matter to them? They think everything, when you want something, they think it's not necessary. I've had you guys tell me um in our video consultations that your doctor said you don't need that. It's not necessary. Well, you think it is. And so do I, maybe. Think it is necessary to get a proper diagnosis. Now, let's go to imaging. If you have this high LDL and it's been rummaging your bloodstream for years, and you say, I think I should probably check into this. Should you get a CAC score? Well, maybe, but you guys are smart. And you know that a CAC, a CT scan of your coronary arteries, is only looking for hard plaque. Hard calcified plaque that has been building up for years. A calcium score is a history book. It is only telling you your past history. It doesn't tell you your future. Even if it's elevated, it doesn't really tell you that you have blockages. It just tells you have calcification. Now, what is the gold standard? Of course, it would be a clearly AI of a CT angiogram. That would be gold standard. That measures the soft and the hard plaque volume. Volume. And then you could make a decision on, do I want to take a medicine? Well, if your volume of your CT angiogram is mostly soft plaque, I know that sounds scary, right? And very little hard plaque, wouldn't you think that you want to drain some of that soft plaque? I say yes. Can you do it? Doctors will tell you no once you have plaque and you can never get rid of it. I say you can get rid of it. How? By having a good immune system. If your immune system is functioning good, the a part of the immune system that drains soft plaque is active. When is your immune system not very good? Let me guess. High insulin, stress, and no sleep. You see how being metabolically compromised, you will have a poorly functioning immune system. So you are inflammatory. Your immune system is actually helping build up plaque. It's going to want to stabilize your soft plaque. You want to drain the soft plaque so you don't have as much hard plaque. You need an active immune system within that works only in a certain environment. Low insulin and low inflammation and low stress and adequate sleep. That's the shoot, we just went off again. Oh boy. That is why, you guys, we need to take care of ourselves, take care of our bodies, lower the inflammation, lower the insulin, get sleep, get out in the sun, produce nitric oxide, stand barefoot on the ground, pray, hang around positive people, all of these things, okay? Here's a question on a CIMT. Okay, what is that? It's of your carotids. It's measuring the carotid intimal medial thickness. It's measuring the two most inner line or the or the two inner linings, the thickness of the two most inner lining layers. It measures the thickness of the inner two layers inside your carotid arteries. Okay? Is that good enough? Maybe. But if you only check in your neck, your carotid arteries, does that see your heart? No. So you could be missing heart plaque, even if your carotid are pristine. Your neck arteries could be clean as a whistle, yet you could still have heart plaque. Usually they go hand in hand, but sometimes they don't. Now, do doctors want to order a CIMT? No. I have to, when I wanted to order a CIMT, I would listen on their neck. And if I heard a murmur, guess what? They might pay, your insurance might pay for it. If not, most people pay for it on their own. It might be, I don't even quote me on it. It could be, I think it's less than $500, but okay. So a CIMT, it's a good test. But like I said, you could look at the carotids and everything will be fine and your heart arteries are full. Overall, what is our plan, you guys? Let's see. Reggie, the lab I do partner with doesn't have those tests. Each lab would have to have a functioning medical director that has a license in every state. Let me tell you, to get licensed in a state is very expensive. It's usually around $1,000. So labs aren't going to pay $50,000 to get a medical director licensed in every state. They're just not going to do it. Okay. Ulta, the lab I partner with, and when I say partner, it's not like they're paying me. I order your guys' labs. They don't pay me. You're paying them. Okay. You guys might pay me to order your test when we do a consultation, but overall, this lab is for you. And they do have a medical director that has a license in about 43 states, yet they don't have on their panel a next generation, the NGS sequencing for the FH gene panel, and they don't do a cholesterol balance test. That's where Ulta is lacking, and that is who I loosely quote partner with. Okay, I partner with them so I can order you guys' labs. Makes sense? I don't know if I could partner with a lipid sequencing lab or a cholesterol balance lab. I have not looked into it, okay? And maybe you guys could help me do some of that legwork. And if it doesn't cost me anything to partner with them, for them to allow me to order those two tests and their medical director who is licensed in your state can okay it. Does that make sense? Okay. Cat Mom says, I went to a doctor. My LDL was 5 points too high. I have Hashimoto's, high stress, low sleep. He tried to put me on a statin. I said no. Let's look deeper. He said, you are too pretty to be fat. I walked out. Wow. Okay, that's a story I've never heard, Cat Mom. Okay. So you have Hashimoto's. That is very inflammatory. That Hashimoto's is basically an inflammatory condition of your thyroid. You have antibodies to your thyroid, an inflammatory state. Your goal is to manage that hypothyroidism so your cholesterol comes down. I don't know what 5 points too high is for your doctor on your LDL, but it's likely not a concern. But again, if you fixed your thyroid, get your T3 between 3.3, 3.0, and 3.5. Make sure your thyroid is converting your T4 completely to T3 and not reverse T3. So, Cat Mom, you need a full thyroid panel, not just checking a TSH. We're talking about your thyroid right now. You're mentioning your LDL, 5 points too high. Your doc wants to put you on a statin when you first want to fix your thyroid. Fix the most common factor first. Make sure you got the T3 between 3 and 3.5. Make sure your reverse T3 is below 15 and maybe even below 12. Okay? Then you work on your stress. Then you work on your sleep. The stress is going to be the death of you, not your 5 point elevation of your LDL. Your stress is likely tied to your Hashimoto's, inflammation of your thyroid. You fix your stress, you likely fix your Hashimoto's. You fix your sleep, you likely fix your Hashimoto's. Okay? If you fix your Hashimoto's, you fix your cholesterol problem. Working on parasympathetic vagal exercises. Work on parasympathetic vagal exercises. Okay? Those will help get you into parasympathetic nervous system tone versus chronic sympathetic nervous system tone. Look back. Why is your sympathetic nervous system so chronically elevated? It probably stems from childhood, where you were raised to be overly detailed, overly hypervigilant, overactively people pleasing, overactively empathetic, overactively codependent, worried about what others think. But the overactive, hypervigilant, detail-oriented person is the one that probably is the one with the high stress and inability to sleep. And as cat mom becomes more in the age group of menopause and postmenopause, cat mom is, at risk for higher heart attacks and strokes. And your LDL of 5 points over what your doctor thinks it should be is not your problem. Cat mom is the person who's going to have a heart attack, and everybody thought that they were so healthy. They exercise, they didn't smoke, they don't drink, they eat a whole food diet, and yet they had a heart attack. You check their LDL, it's 5 points too high, whatever that means. And yet they're full of stress, chronic sympathetic overdrive, and probably high cortisol leads to high blood sugar, leads to high insulin, and they probably have a touch of fatty liver disease. It all goes back to our metabolics and the way we are taking care of our body. Reggie says, thank you for your time and sharing your information. Very much appreciated. Thank you, Reggie. Christine says, my doctor is my brother, so I know he's out for my best interest. Extremely thorough. Christine, be very, very careful. Your brother should not be treating a family member. Please do not tell that publicly, although you just did. That puts your brother at risk, okay? His board, his certifying board in his state is very critical of doctors who treat their family members, okay? There's certain things that boards frown upon, and that is one of them. So please keep that to yourself. Cat Mom says, endo, that's the kind of doctor I went to. I have been to two of them. Never again. Will I waste my time? Okay. I try to manage it all mostly with food and supplements because I can't get any doctors to help me. Cat Mom, order the labs that you need to get and pay for them yourself. But simply taking supplements might be the wrong thing to do. You might be taking a supplement that will lower another lower something else in your body, and now you have a problem. So don't just blindly take supplements, okay? Not a good thing. Jacqueline says it's $250 with cardio risk. $250 for which test? Is that the cardio risk? I help me out. There's people labs call it different. Um, so let me know what's on this cardio risk, okay? Jacqueline, please help me out there. Okay. Amanda says I started taking creatine. Is that a good idea? I think it's fine, Amanda. I don't think that anything's going to happen with you taking creatine. Okay. But if you are eating a high meat diet, you might not need creatine. Although if you listen to thank you. The original K just gave a super chat of $10. So let me get to that question. But Amanda, to finish off, I don't think that if you're eating a high meat diet that you need creatine, although there are some doctors or some providers out there that say that we are not getting enough creatine for our brain and our heart and suggest upwards to 15 to 20 grams per day. So I don't know if the in the studies are written in stone, but to answer your question, is creatine going to be bad for you? I mean, highly unlikely. Okay. The original case says, thank you for everything you do for complete strangers. You're very welcome. Your God-given gift to all humanity, still cancer-free. Bye-bye lymphoma. Awesome. Original K. Thank you for the super chat. Thank you for the kudos and the compliment. I appreciate that. Okay. Oh, thank you, Jacqueline. Thank you for that. So Cardio Risk is a company that does the CIMT. So Jacqueline says to get a CIMT, a carotid intimal medial thickness test of your carotid artery is $250. That is not bad, you guys. And that will give you a general idea. Let me just say, if Jacqueline gets this test and there is plaque in the arteries, the carotid arteries, you can pretty much speculate with high probability that you have buildup in your heart. If you have no buildup in your carotid arteries, that doesn't necessarily mean you have no buildup in your heart. Make sense? Okay. Nin says to Amanda, thank you, you guys talking. This is good that we have an ability to talk back and forth kindly. Nin says to Amanda, if you are taking creatine, make sure it is quality product. The cheaper stuff may have contaminants such as heavy metals. So Amanda, Nin, Nin on YouTube is trying to help you out. Okay. So usually pick something like Creapure or just do your research and make sure that the company you use has certifications and make sure it's clean. So Nin is looking out for you and hoping that you're not picking some cheap creatine monohydrate, which is monohydrate is the best one, okay? That you're not just picking a cheap one that could be contaminated. Good point. Let's see. Jacqueline says Dr. Ford Brewer recommends that place. What was it again? Cardio risk. So Dr. Ford Brewer recommends cardio risk to get your carotid intimal medial thickness test, the ultrasound, the duplex of your, not duplex, the ultrasound, the special ultrasound of your neck arteries. Good. Okay. I'm not quite familiar with Dr. Ford Brewer. Heard of him, but just not like I haven't watched him at all. I don't even know if he does stuff online. Jacqueline says, I have 4 plaques. Yeah, that might indicate that you have plaques in your heart. Okay. John, if there is plaque, it's either because you smoke, have uncontrolled diabetes, or history of inherited hyperlipidemia. So John might be just jumping in at the end here. And if John were to go back, okay, John would know that we talked about FH, which is the inherited hyperlipidemia. So either heterozygous FH or homozygous FH, whether or not the person is a hyperabsorber or an overproducer or has fatty liver, which would make them a hyperproducer. But yeah, what John is saying is that even if you have FH, maybe you don't have an injury to the lining of your arteries for those bad LDLs to become sticky and cause a problem. I mean, if you look at studies on FH, heterozygous FH, if those people have light and fluffy, buoyant LDLs, guess what? They actually live longer than a person who doesn't have high LDL. Okay, so smoking, alcohol, sugar, which is insulin resistance, which is diabetes, heavy metal toxicity, seed oils, diesel fumes, plants, being around burning plants, all of those things can lead to injury of the lining of the arteries. Okay, that causes an injury, and now we've lit the fire for particles, even platelets, red blood cells, white blood cells, small dense LDLs, LP little a, all of them, to stick to the injury, form a clot, and over time get calcified. Worst case scenario, that clot, the soft core, breaks off, goes to your brain, goes to your heart, you have a brain attack, otherwise known as a stroke, or goes to your heart and you have a heart attack. Okay. Oh, Amanda, White Mazda also recommends drinking it with warm water for better absorption. Both of your knees get very swollen. Any thoughts? You have an inflammatory condition that might not be related to just bone on bone. What inflammatory condition do you have? Did you get labs? What's your uric acid? What is your HSCRP? What is your SED rate? What's your insulin level? What's your RDW level? A lot of things, White Mazda. I can't speak to what's causing it. Jacqueline says Ford Brewer is on YouTube, a preventative cardiologist, and has his own company. Nice. I will look into him. Thank you. Amanda says 5 milligrams of creatine. I'm 55. Yeah, Amanda, I think 5 milligrams is just fine. It's obviously it's not going to hurt you though. How about that? Love Joy Peace says I have Hashimoto's, a TRAD score, so a thyroid uptake. It's an imaging, a TRAD score of 3.4. 3.4, you want it in the 1 and 2. So 3.4 is riskier, and their PCP wants to do a biopsy. So basically, a needle aspiration. Should you? Well, you want to know if your thyroid nodule is cancerous and the TRAD score in the 3 to 4 is more probable than a score of 1 or 2. So is that a good idea to biopsy that nodule? Maybe, maybe not. Do you poke a sleeping bear? Maybe not. Okay. I personally would work on my Hashimoto's. I would work on my body inflammation. I would want to know what is going on and causing the inflammation in my body and in my thyroid. And I would start one with diet. Then I would do stress and sleep and sun and nitric oxide and all of the things that I pick apart every single reel and every single live stream. Metabolics. So maybe love, joy, peace. Maybe that radiologist was saving you because they denied it. Maybe they're saving you from poking a sleeping bear that could spread to the rest of your body. I don't know. Okay. But I'm just bringing up all of the things that you need to think about instead of, getting upset that that radiologist denied you. If you also have rare autoimmune disease, super inflammatory, right? Work on it, okay? You need to work on it, okay? And your doctor is probably going to be an online doctor if your personal doctor, does not want to look into it. I know it's sad, but you know what? The world is changing. We have online doctors now. Amanda says it's an Amazon brand. Just look into it, Amanda. Just use whatever AI and have them analyze it and see if the Amazon brand has been testing for heavy metals and see if it's certified, even from one certifying agency. Okay. Cat Mom says, when my knees and ankles swell, it's usually because I've had too much sugar. So yeah, keep it lower then, right? To reduce your inflammation. Nuts can do it. They're plants. Nuts with seed oils increase inflammation. So that could be a cause besides just sugar. It could be seed oils. Um, it could be high plant diets. High plant diets are very inflammatory. Nina says, create brand is NSF certified, used, and used Creapure. Okay, great. It's monohydrate and one of the best ones out there. So Amanda, Nina says the brand Create is certified and uses Creapure. So that might be an option for you. Okay. I don't know how much it is. And maybe Amanda can only afford the Amazon brand. Somebody else says that Thorn is a very good brand. Good. Okay. All right. Yes, you're very welcome, Amanda. Yuli says, is carotid Doppler ultrasound conclusive enough or not? No. I have a calcium score of 0, but thickened carotid arteries. So is the thickening from soft plaque and it's not yet calcified, giving you a calcified score? Your calcium scoring test of 0 doesn't necessarily say that you have 0 soft plaque. Your carotid arteries are saying, yes, you have a little bit, but it's less than 50%. The doctors do not do anything until it's over 50% decreased blood flow. So if you're just looking for blood flow, you are not really measuring the actual carotid intimal thickness. Okay. Blood flow and thickness might be different. Okay. Jack says, have you heard of erythrocyte sedimentation rate, ESR, to assess general inflammation? Yes. Getting a high HSCRP, getting a SED rate or an ESR, getting an interleukin 6, IL-6 would be great to check for inflammatory markers. Those are 3 of the best. Are there more? Absolutely. Insulin, getting an insulin level is an inflammation marker. If it's over 5, you're inflamed. So is Yuli inflamed? Is whoever we were talking to about earlier, are you inflamed? Okay. The carotid duplex or the Doppler. Yep. Okay. Staying keto. Instagram was cut off. I know, 4 times now. I had my CT scan. Oh, of your chest. They said 10 to 14 days for results. radiologist shortage. Isn't that ridiculous? Absolutely, staying keto. That is ridiculous that they shouldn't have that result in 24 hours. I'm sorry to hear that. Yeah, Lovejoy, if your HSCRP are high and your SED rate is high, yep, you are very inflamed and you are at higher risk of a heart attack or stroke. Lovejoy says, do you do online video visits? If so, can you please tell us how much you charge and how to schedule? You can schedule it by emailing me at ironladydoc@aol.com. IRON, Iron Lady, LADY, DOC, doc, at AOL.com. What do I charge? I charge by the hour. We spend time, every minute that goes by, that is a charge. So by the hour, it's $150. If it's 45 minutes, I charge you for 45 minutes. If it's 75 minutes, I charge you for 75 minutes. I don't, if we talk for 15 minutes, I don't charge you for an hour. Okay? All right. Cat Mom says, I was vegan for 45 years. This is what messed me up. And the Hashimoto's. I am now carnivore, but I do use almond coffee creamer. Get rid of that, Cat Mom, and go to whole animal cream. You do not want any more inflammatory almond plants in you with all of that sugar. It is no nutritional value and doing you harm, okay? Get rid of the inflammation and maybe your Hashimoto's will improve. How do I get off a statin? Talk to your doctor. Wean off of it over the month's time. Cat Mom says, I just love you. I found you today and I'm a fan already. Thank you. Hopefully you've hit the thumbs up and subscribed. Hit the thumbs up, everybody, over on YouTube. Please. That would help me out. You're very welcome, Lovejoy. Okay. Yes, email me at ironladydoc@aol.com. Tia is just joining us. Hi, Tia. Thank you for being here. Okay. Lucy, did I miss a question in there? Okay. Oh, another thing I just thought of with the joints for inflammation, get a uric acid level. Uric acid is also a great inflammatory marker. So, we'll review. Jack says, is ESR good? Yes. So a SED rate, otherwise known as an ESR, erythrocyte sedimentation rate, ESR. So that is a good one. HSCRP, uric acid, IL-6, get an RDW. Almost everybody gets an RDW. It's on your CBC. Jim says gout. What about gout? Tell me about your gout. Not all people with high uric acid will have gout. Okay. Good morning. Blessings from Tia. Thank you. Amanda says, I ate perfectly clean. Amanda, you probably have not been on here, and please don't take this as very sarcastic. I'm asking a question. Does clean diet mean that you washed off your diet with soap and water? Because I don't know the definition of your clean eating. So please share what clean eating means to you and why you did not lose a pound. How do I lower my cortisol if that is the problem? I'm 55. You need to lower your stress. You need to sleep 8 to 9 hours a night, uninterrupted. You need to Google parasympathetic exercises to raise parasympathetic tone and lower sympathetic tone. Okay? All right. Jim says, my uric acid was 13.9. Yikes. Should be less than 6, right? Jim took allopurinol. So Jim jumped right to a medication to lower his uric acid to 5.7. What was the diagnosis of Jim's high uric acid? Maybe Jim doesn't know. Maybe Jim just decided, I'm just going to jump into taking a medication and lowering it. I don't care what raised it. Well, if you become a client of mine, I want you to know what raised your uric acid. Were you just starting a carnivore diet? And your body, when it starts burning off a whole bunch of ketones, it the early carnivore diet strapped your kidneys, and while your kidneys are working on all the ketones that are going through the kidneys, it put uric acid on the back burner. So we have high uric acid either because we are eating too much, making too much, or not excreting enough. Okay. And it's usually the not excreting enough that makes up 70% or more of high uric acid. So why wasn't Jim excreting his uric acid? I don't know. He doesn't drink. He doesn't do carnivore. Why is Jim's kidneys not excreting uric acid? I don't know. What is Jim's kidney function? Okay. Is Jim eating a whole bunch of purines? I don't know. We don't know Jim's history. Uh, La Presque. Hopefully I said that right. Hi, Doc. Thanks a million for educating us. You're welcome. Truly a blessing. Thank you. You are too. What foods do you recommend for estrogen loss, menopausal women? Do you also recommend replacement therapy? Thanks for your knowledge. Oof, big question. If you don't want to take estrogen, if you don't want to take hormone replacement, you have to make sure your adrenal glands are functioning well. To make sure your adrenal glands are functioning well, they need an environment that is not stressed. So if you have stress or you're not sleeping, your adrenal glands will not make estrogen. Okay? If you are insulin resistant, your adrenal glands will likely not kick in and make estrogen. Should you take estrogen? Well, did you try to allow your adrenal glands to make estrogen? If you did and you say, Doc, I can't lower my stress, I can't sleep, yet, I'm thinking about estrogen. Be aware that HRT, estrogen therapy, is plant sterols. Plant sterols. We are not a plant. We are an animal. We use cholesterol. Plants don't have cholesterol because they're not animals. They have plant sterols. What if you are high in plant sterols, meaning you're a hyperabsorber? Could the very thing that's supposed to give you estrogen to lower your LDL actually raises your LDL because you are injecting yourself with plant sterols? I don't know. I don't know. It just came to my head. What if you don't eat cholesterol? What if you say, oh my gosh, I'm fat free, doctor? I eat some plants, but I don't want that fat. That saturated fat causes heart attacks. Now I've got to work on your brain and remind you that the lipid hypothesis of coronary artery disease is probably not relevant to today's thrombogenic hypothesis of coronary artery disease. So, to answer your question, should you take hormone replacement? That is up to you. But did you check to make sure you're eating enough saturated fat and cholesterol in your food, like ribeyes and ground beef and pork or chicken or whatever you're eating animal wise? Are you getting enough? If you're not getting enough, start there. If you're not sleeping, fix that. If you're stressed, fix that. Then go with a medicine if you truly want a medicine, which is plant sterols. Okay. Jim says, I have CKD, chronic kidney disease. So that could be why Jim is not getting rid of his uric acid. His kidneys cannot excrete I don't know what stage, CKD stage 1 or 2 or 3 or 4 or 5. That's the worst, CKD. But let's talk about what Jim could maybe do for his CKD if it's like stage 2 or something. What if Jim, who doesn't eat carnivore, right? Jim said that. Jim might not be getting enough glycine. Why does glycine matter? What is glycine? Glycine isn't an amino acid. Glycine is an essential amino acid. What does that mean? We make glycine. We make about 2 to 3 grams a day of glycine. Is that enough? Highly unlikely. Why do I know? Jim has high uric acid. Guess what? You need glycine to get the kidneys to work to get rid of, excrete the uric acid. So maybe Jim's CKD was caused by the high uric acid and not the kidney disease causing the high uric acid. So Jim has high uric acid, and intertwined in there, the kidneys aren't working. Which came first? I don't know. Could you give Jim some glycine, upwards to 12 grams, and get his kidneys to excrete the uric acid? We need about 2 glycines. I'm not sure. I'm not, retract that last statement. I don't know exactly the ratio of glycine to uric acid that we need to get the kidneys to kick in and start excreting that uric acid. I don't know. I'd have to look it up. What I'm saying is that glycine is an amino acid that we need more of than just plain 2 to 3 grams a day. So glycine has been called a conditionally non-essential amino acid, meaning our body doesn't make enough for us to repair everything. Glycine is anti-inflammatory. Glycine takes care of methionine. Glycine takes care of uric acid. Glycine takes care of our colds. Glycine takes care of our muscle aches and pains. All of the inflammation in our body gets cleared by glycine, a simple, relevant amino acid that also you need in high concentrations in order to make glutathione. Glutathione is our master antioxidant, our master immune regulator. You don't have glycine, your immune system sucks because you don't have an antioxidant called glutathione. So you'll just take glutathione. That's what I hear you guys say. Well, I'll just take glutathione. Not a good idea. You can't just take a synthetic something or other to make up for what you're doing to your body that your body can't make enough. Make sense? All right. Ooh, these are deep. You're making my brain work today. Staying Keto says, do you eat all grass-fed beef? What about Costco USA beef? Staying Keto, if all you can afford is Costco USA beef and it's not grass-fed, you're fine. It is a ruminant meat, meaning it has multi-chambered stomachs. 4. So for the most part, your beef, bison, buffalo, sheep, lamb, deer, you'll be fine. Eat what you can afford. Do I always eat grass-fed? Absolutely not. I don't have access to it. I do have access to it. I have to watch. Just hear me out. I do eat grain-fed beef. Do I eat grass-fed beef? Yes. Am I worried about the grain-fed beef? No. Will I eat a grain-fed chicken? No. A grain-fed egg? Eh, maybe. But not a grain-fed turkey, not a grain-fed. Thank you. Who gave me that? Jim, thank you so much for the super sticker. I appreciate that. Thank you. That means a lot. That means that you appreciated me telling you about your CKD, your uric acid, and perhaps a glycine deficiency. Thank you. The show life says, what if my body says, I just lost it. F everything. F everything. Should I calm it down with weed? It I can't answer that for you. Would I add in a plant, a smoking plant that could cause me to have high. Thank you, Jim. I appreciate that super chat. The show life, I can't see me putting a burned leaf or burned weed in my body that could possibly increase endothelial damage, meaning an injury to my artery linings. I can't do it because what if I have stress? What if I have no sleep? Do I just take weed to calm my body? I say no because I could add to more injury. The uncalm is injury. So the stress and no sleep is injury. Do I add another injury? No, me. Could it calm you? Maybe, but it could be worsening injury. And I say, which is worse? I don't know. I don't know where you're at in giving it all up. I'm not even close to where I would say F everything. I'm still working and working out what I can do to be naturally healthy. Okay. I want to work on all of the things. I could be working on all of the things for the next 50 years and never come up with an adequate plan, but I will never say F everything and just smoke weed. That's just me. But this is not medical advice. It's for information purposes only. And you said that was a question to me, and I gave you an answer. But nobody's telling you what to do, okay? Jim says, ruled out kidney cancer. Great. And ruled out multiple myeloma. Praise the Lord. With a renal biopsy. Great. The show life says, I love ribeyes. Me too. I love ribeyes. Jim says, I have CKD stage 3B. So we're getting close to maybe the kidneys not coming back. But I have seen and I've heard, like Dr. Barry talks about many of his CKD 3Bs and 3As coming out of it with a carnivore or a ketogenic diet. Now, I would say if you went carnivore, Jim, or wherever you're at, if you are only eating muscle meat, you are very, very high in methionine and zinc for that matter. You absolutely do not have enough glycine to take care of all of the methionine in your muscle meat diet. You could be worsening your CKD3B with a carnivore diet unless you ate a ton of cartilage, a ton of skin, a ton of bone broth, got Paleo Valley bone broth powder, and got more glycine. Jim, glycine is needed if you're a carnivore eating muscle meat high in methionine. I do think that you need 2 glycines for every 1 methionine. Okay. It is a tremendous amount that you need in order to take care of the methionine. If you have high methionine, you're going to have high uric acid. Don't just take a pill. Okay. Yeah. Thank you for that. I appreciate that. Okay. Jim says, oh, Just got home from Mayo Clinic. No, okay. Oh, Michael is listening from Rocky Point, North Carolina. Where is everybody else listening to or listening from? Tia says, I take torsemide. It's a diuretic for heart failure and have gout because of the torsemide producing high uric acid. So you can't get rid of it. See how a medicine can cause another problem? That's called whack-a-mole medicine. You got this, so I give you that. And then because I gave you that, you get this. And so because you got this, I give you that. And because I gave you that, you get another this. Whack-a-mole medicine. So why did Tia get heart failure? Did Tia have high blood pressure? Did Tia have high blood pressure because Tia had high insulin and insulin resistance? Did Tia have high insulin causing high blood pressure, and the high insulin was from high blood sugar from eating a high carb processed food diet? And over years and years, Tia gets heart failure, usually associated with diabetes. Then doctor gives said torsemide, which is a diuretic, and now Tia gets high uric acid and gets gout. Why didn't we just fix the heart failure and hopefully get it back? I don't know. Yeah, show life. Yeah, powerful words. Thank you. Try ashwagandha before smoking weed? Yeah, maybe. But I would just really look up Jack, I understand ashwagandha. I do. It's an herb, but hey, maybe Show Life really needs to Google some exercises for parasympathetic tone and start working on things that Show Life can make changes on, okay? WT says, I don't consume weed, but I think edibles would be safer if one decides to partake in the devil's lettuce. Okay. Hypercalcemia is supposedly causing my CKD, says Jim. Then why do we have hypercalcemia? Do you have a parathyroid tumor? Have you obtained a PTH, intact PTH? Jim, do you take high doses of vitamin D? High doses of vitamin D will cause your gut to absorb calcium and get it back into the bloodstream. And if you got it in your bloodstream, guess what Jim is a setup for? You guessed it, plaque in his coronary arteries causing clogging them. Just because we have hypercalcemia. Just because he took vitamin D. That caused his CKD. And now he can't excrete his uric acid. So did we go and find out the cause of the hypercalcemia? And then did we look into what could stop the high calcium in his blood? The high calcemia. Emia is blood, high calcium in the blood. Hello from Rus, R-U-S. What is your state? Iowa. I eat very little meat. So if you're eating a plant-based diet, is that elevating your uric acid? Too many purines? I don't know. You need to look into it. Are you, because you're eating, I got it, Jim. Could it be, this is speculation, you're eating a whole bunch of plants. Plants have oxalates and phytates. Oxalates and phytates block the absorption of calcium. Your body senses low calcium. Your bones start to leach calcium and dump it into your bloodstream. Now you have hypercalcemia, which causes your kidney disease, if that's what caused your kidney disease, just because you ate plants. Because of the phytates. And Jim, have you gotten a DEXA scan and see where your bones are at? Is your bones leaching out all of the calcium and into the bloodstream, causing your hypercalcemia, which is causing your kidney disease? which is causing your uric acid disease, requiring you to take a whole bunch of pills. I'm just trying to connect dots here. I don't know. Hannah is listening from Missouri. Thank you. As we get older, says Justin, as we get older, we lose the hormone that keeps us from producing urine at night. Is there anything to replace this hormone? I wake up twice a night and have difficulty going back to sleep. What if Justin is in sympathetic overdrive, causing the kidneys to produce more urine? And it doesn't take a lot of urine to fill into the bladder. Usually, this urine is very weak, meaning low concentration. So the kidneys are working overtime. Is it an age thing? Not sure. Is it a sympathetic overdrive? Could be. Stress. Could it be high insulin resistance, especially at night, causing you to get up and go to the bathroom? Yes. So is it an age thing? I don't know. Jim says my PTH was low. Okay, so we ruled out a parathyroid tumor. Don't take vitamins. I avoid calcium in my diet, but you didn't answer the vitamin D supplement. Do you take high dose of vitamin D? Do you take K2 to help with the calcium buildup? Not a lot of plants. Jim, if you don't eat a lot of meat and you don't eat a lot of plants, what are you eating? Those are the only two things you can eat. If you don't eat meat, the only option is you are eating plants. If it's not an animal, it is a plant. I don't mean a vegetable plant, but it could be wheat plant, oat plant, rye plant. Anything that makes goldfish is a plant. If you eat oatmeal, it's a plant. Pasta, a plant. A potato's a plant. Tea is a plant. Coffee's a plant. Jim, are you eating a bunch of plants? Because you have to be if you're not eating a lot of meat. Yeah, Jim hasn't had a DEXA scan. I probably would do that. Jim says endocrinologist suspects sarcoid. Why? Why sarcoid? Okay. Jim is not taking extra vitamin D, so that really puts a hole in my theory. I mean, Jim could be eating things with high D, and that could cause hypercalcemia. Jim's not eating any K2. I probably would if I had hypercalcemia because I don't want that plaquing up in my bloodstream. So I'm going to take K2 to try to put it back into my bones and teeth. I eat some meat, grilled chicken, and salmon. Okay. Yeah, Jim, I don't know. I'd have to look into more things. I gave you my 1-2 second connecting the dots, and apparently I'm wrong. So it's not that I'm wrong. We went down, we ruled out one of my pathways. So that's probably not it. Tia says tends to block uric acid and gives me painful gout flare-ups. What can I do? Figure out why you have heart failure. Karen asks, have you ever heard of LADA? Yes. And I do not see it very often. It is basically type 1.5 diabetes. I have seen, one of my friends has what I think is LADA, and it is not showing itself. Could it? Yes. How do I know? I happen to get a GAD antibody on one of my friends, and it was positive. That puts that person at risk for diabetes in the future. And LADA turns into basically a type 1. Okay. We need to know what Karen's C-peptide level is. C-peptide. If the C-peptide level is above 1, we know her pancreas is still producing insulin. So she's not a type 1 yet. However, Karen also needs the 5 antibodies that test for type 1 diabetes. Get all 5. Don't just let them do 3, Karen. Don't just get a GAD antibody. You need all 5. Karen cannot take metformin. Karen, can you do a carnivore diet? Remember, diabetes is carbohydrate toxicity. Your pancreas is still working. So you need to make sure that your pancreas only needs to secrete as much insulin as you need to take care of what you're eating or your stress or not sleeping. So you don't want your pancreatic beta cells pumping out a bunch of insulin because you're eating a crapola diet, stressed and not sleeping. Okay? All right. I can't take metformin due to GI issues. Yeah, probably diarrhea. You can get an extend release metformin, but again, metformin is a mitochondrial toxin, so hopefully you're aware of that. I mean, I would work on a low to no carb diet, exercise. The more muscle you have, the better. Your muscle acts like a sponge for blood sugar. So then you could avoid the GI upset altogether. All right. Nina says, I have RA, rheumatoid arthritis. My high sensitive CRP is always over 7. SED rate over 40. Yikes. Those are both high. CT scan was 0. And CT angiogram also 0. How much do I have to worry about heart disease? I'm on Humira. That's why you have to worry, Nina. You're on a medicine that is blocking your immune system. So you are turning down your ability, your body's ability to function. Okay? Why do you have RA? What are the symptoms? Usually, if you fix the insulin resistance, fix your sleep, fix your stress, increase nitric oxide, you can likely lower your symptoms of RA and never need a medicine. Don't drink alcohol. Don't eat plants, or very few, and make sure you really cook them, boiled them for 20 minutes maybe. But those are good things. But yeah, I think you're probably feeding a problem with those medications. Tia says, I watch my period intake to avoid gout. What else? Well, you could be low on glycine, just like I talked about. I'm on allopurinol. Yeah, it seems like a go-to. I guess I don't understand. We got to figure out why people are, high in uric acid. Okay. And I'm guessing it could be just connecting the dots here. It could be a glycine problem. Okay. Justin says 70 years old, retired, no stress, athletic, 5'7", muscular, 30-inch waist. Make all my meals from scratch. I don't know what that means. I mean, all your meals from scratch could be high in flour and wheat and all of that stuff. I don't know. How many plants. I feel like no sleep is aging me. Yeah, join the crowd, bud. Lack of sleep is a killer. People can have heart attacks from lack of sleep. Just simply lack of sleep. When your mind is over hypervigilant and you're not sleeping, you are causing insulin resistance and high risk for heart attack and strokes as we speak. Justin doesn't smoke, drink, eats only meat. I mean, yeah. Heart attacks and strokes from no sleep and stress. How do you increase nitric oxide? The sun is a great way to increase nitric oxide. You could take citrulline malate. It's a powder that will help you increase your nitric oxide production. Our body makes nitric oxide, but if you are stressed and have a bunch of reactive oxygen species in your body, you're going to end up using up all of your nitric oxide on the free radicals. So if you've developed a lot of free radicals in your body, we have to have some, But if you have more than some, you're going to use nitric oxide as part of the defense to neutralize reactive oxygen species, ROSs. So if your body is chronically inflamed, you're not sleeping, you're eating a bunch of plants, you're not exercising, you don't hug trees and get in the sun, then yeah, you could have low nitric oxide and or high reactive oxygen species and low nitric oxide. So yeah, and a lot of stuff can cause free radicals. I just gave you a handful of things. We need them. You, but we have antioxidants in our body, like the glutathione I spoke to before. We should be taking care of our reactive oxygen species, but we don't. We just have way too many. We need some, or else we would die. But we don't want too many, or else we will die. Lucy says people eat too many fruits and their uric acid goes up. Yeah, okay, doctor, tell them. Thank you, Lucy. Yes, if you are eating fruit, I should have mentioned that the number one cause of high uric acid probably should be fruit. For every fructose molecule, we have one uric acid molecule. So a person with high uric acid should never eat fruit. Never. That is all I have to say about that, right, Lucy? Anne says, should citrulline malate be in the L form? Yes. L-citrulline malate. Correct. Yep. Good. Thank you. Doctor, tell them to stop and eat meat. Okay. Yeah. The the meat might not be the problem, okay, for your high uric acid, but the meat could be the problem if you're only eating muscle meats and not eating bone broth. If you only eat muscle meats, you're going to be high in methionine. And then, while we're speaking to the methionine, if you have MTHFR, MTHFR, then you cannot methylate. I mean, there's 50% of you that cannot methylate with MTHFR heterozygous. You have one gene. Your homocysteine is going to go up. All of that. So high meat and MTHFR, so high muscle meat plus MTHFR, whoa, high risk of heart attack. What do? You take methylated vitamins and you add glycine, 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 and you don't eat fruit, right, Lucy? Lucy says, so that is what the doctor told my mom. Stop meat and beans. Never mentioned the fruit. That because they didn't know. Lucy, I know, but your mom's doctor did not know. The very person who should have known, right? But then again, if I go back in time, 5, 6, 7, at least 10 years ago, did not know. Didn't know to ask about fruit and uric acid. Did I tell the people not to eat fruit? Absolutely. I have never been a proponent of fruit. But did I talk about the connection of uric acid? No. Did I even check uric acid? No. Do I now? Yes. Yes. Uric acid, high uric acid leads to heart failure and coronary artery disease, heart attacks and strokes. Heart failure, coronary artery disease and strokes. So no meat, no plants, no fruit, no food. I didn't say no meat, Jim. I said don't eat only muscle meats and forget to eat things with glycine in it, which is bone broth and skin and cartilage and tendons and everything on the animal. If you only eat muscle meat, you are going to be high in methionine, and then you will use up all of your glycine to take care of the methionine. When you use up all of your glycine, then you don't have any glycine to help your kidneys get rid of the uric acid. Hopefully I explained that. Lucy says eat nose to tail. Great. Or take glycine supplement or Paleo Valley bone broth protein or magnesium glycinate. That's glycine. You need 12 grams about per day because our diets suck. Our world, modern air quality sucks. Okay. Tia says, I love beef, but I have congestive heart failure. CKD3. So how can I eat all that red meat? Well, why can't you, Tia? What is it about red meat that's causing your congestive heart failure, your CKD3? I don't understand. I'm guessing it was your diet before or whatever you ate with your red meat that caused your heart failure and your CKD3. Okay? Your red meat alone did not cause your congestive heart failure and kidney disease. Okay? But the foods you probably ate was processed, high in carbs and seed oils that led to insulin resistance or type 2 diabetes that led over time to CHF and likely coronary artery disease and your CKD3. Remember, the cardio-renal system. It's all one system and it's metabolically related, okay? Tia says, which glycine do you recommend? You can get glycine from eating your bone broth. You can get glycine from like a brand called Now. You could get Paleo Valley bone broth that has glycine in it. So if you add it all up, let's say your body makes 2 grams of glycine, and then you eat red meat that has, and through the day, you get another 1 to 2 grams of glycine. Then you take some 400 milligrams of magnesium glycinate. You get another 1 or 2 grams. Then you take some Paleo Valley bone broth and you get another 1 to 2, let's say 2 grams. I don't know what this is all adding up to, but you can see how if you supplement glycine or eat nose to tail every single day, you're going to get enough glycine. But the fact is, our world today is high stress, low sleep. We are using up the glycine that used to be enough, and it is not enough anymore. Lucy, if glycine causes crazy dreams for you, it's, just take your glycine earlier in the day. Okay? Yeah, just take your glycine earlier in the day. Cat Mom says, I use Paleo Valley bone broth powder. Make sure you get the unflavored, okay? And get their meat sticks. You don't need them. That's a waste of money. You need to eat meals of fat and animal meats. You don't need a processed stick of meat. I keep in the car in case I get hungry. You shouldn't be hungry. You should eat meals until you're comfortably full and then eat again when you're hungry. A meal, not a stick, not a meat stick. And no, I doubt they even care that I promote them. I really, nobody even knows who I am. Okay. I'm a nobody. I'm glad about that. So I don't think they care, and nor do I care if they care that I am mentioning Paleo Valley. Okay. I look at a company that has certifications. If they've been certified, I mean, it would have to be because one of those tiny little bags is like $60. And that might last you a month. So if you can pay for the $60 a month for glycine and then whatever else you're buying, then awesome. Okay. But not everybody can afford all of that. But is Paleo Valley certified? I'm pretty sure that they have gone the mile to make sure that they have the best quality bone broth cartilage in their powder to give you enough glycine. But it isn't enough glycine because we are sick people and we need even more glycine than whatever paleo. That's just a supplement. A supplement. Okay. Jim says, you look healthy. Thank you. Do you run? Absolutely not. Absolutely not. I would never run. I don't want to risk getting coronary artery disease. Lots of cardio? No. I lift weights, right, Lucy? I lift weights and I might walk. I definitely walk outside in nature at least 45 minutes a day. And like today, I did 15 minutes of slow bike just to take the time up. Okay. Slow bike, like level 4, just pedaling and looking out at the sun outside. Okay. I think that the chronic stress from running increases our pressure in our bloodstream. It increases blood pressure. That chronic high blood pressure from chronic cardio, especially high intensity, just running 6 miles a day, causes turbulence in our arteries. And that turbulence leads to injury. And then the injury attracts blood clot to heal it over. And if you've been eating sugar and have high insulin and you're drinking alcohol and you're smoking and you don't sleep and you have high stress, heart attack and stroke. But no, I would never do cardio. I'm so glad that I learned not to run when I was in high school. Long distance. My dad was long distance runner. I think most of you have heard this story. My dad ran his entire life from junior high until he had a 5-vessel coronary bypass. My dad used to eat, we're talking 60s and 70s. Well, 30s, 40s, 50s, 60s, 70s. What I would consider a standard American diet for the time, meaning he ate potatoes and gravy and butter and cream. His dad delivered creamery. He worked for a creamery. And my dad's dad would deliver cream in a van or a truck. And this was in Michigan. And so they ate a lot of those things. Then when my dad went to the doctor, he was told that he had high cholesterol. And so they put him on a statin. And he was on a statin for over 30 years. And they told my dad not to eat meat. And my dad listened to every word that they said, and he stopped eating meat. And so that meant his kids stopped eating meat. We boiled our chicken. He went to sugar-free ice cream and bran flakes every day, sometimes twice a day, because he was told to eat fiber to bind up the cholesterol, along with the statin. And you guys know from listening to me that statins block the mevalonate pathway. So my dad wasn't making CoQ10. Did they tell him to take ubiquinol or CoQ10? No. Did they tell my dad that it blocked vitamin D and he should take vitamin? No. Did they tell my dad that it blocks vitamin K? Absolutely not. Would my dad know to take vitamin K? Nope. Did my dad know that it decreased his hormones and his testosterone went down to like 180? Did they tell him that the statin could do that? No. Did they tell my dad that he could get type 2 diabetes? No. Did they check? No. Was he a type 2 diabetic? I don't know. He was a skinny little man at 140 pounds and 5'10". He was a $140. I weighed more than my dad. Could he have had insulin resistance and fatty liver disease? Yep. Could statins increase plaque formation in a man who was running, had high turbulence, and had 5-vessel disease? Yes. One more reason why doctors are the 3rd or 4th leading cause of death. My dad ended up with a form of a neurodegenerative disease. Why? Because they lowered his cholesterol so much. He didn't have enough fat and cholesterol to make the cell membranes that make myelin. So fortunately, my dad passed away still having a brain, but he couldn't talk. He couldn't swallow. He had a form of Parkinson's called progressive supranuclear palsy. Huh, must have been hereditary. Really? How? I don't know. Could it have been? Not sure. But he ended up passing away 7 years following that diagnosis. Did my dad have those arteries bypassed? Absolutely, all 5 of them. He had no death of his muscle, cardiac muscle, because even though 5 vessels were 100% blocked, he had all collateral flow that fed his muscle. He did not have a heart attack. Did they fix the arteries anyway? Yes. Did my dad end up with AFib? I'm not sure. Did he end up with heart failure? Yes. Yeah, Jim. Antacids also increase calcium. You're exactly right. It is a story, you guys. Is it mean that everybody who does ultra long runs, are they going to get coronary artery disease? No. I pray that doesn't happen. But I've seen it all too frequently that people who do a lot of cardio, intense cardio, ultra marathoning, ultra long distance bike riding. Yeah. I have a feeling that all of that turbulence from the pressure is causing injury, and it's chronic and it never has a chance to heal. Tia says, which glycine do you recommend? Maybe try a brand by Now, NOW. Okay. Yes, Debbie. Is glycine the same as magnesium glycinate? Yes, in magnesium glycinate, okay, here's a great point that I want to make. On the bottle, it will say magnesium glycinate. For instance, I'm going to give you magnesium glycinate 60 milligrams or magnesium 60 milligrams. And then below that, it'll say, and this is per 1 capsule. And then below that, it'll say magnesium glycinate 400. And you think that the 400 is actually in the 1 capsule. It is not. That's weight. You want elemental magnesium. That is the 60. So to get 400 milligrams of magnesium glycinate, which contains about 2 grams of glycine, you need to take at least 6 or 7 of those elemental 60 milligram magnesium glycinate tablets or capsules or whatever you're using. Debbie, I hope that makes sense. Turn the bottle over and read how much magnesium glycinate is present. It's usually the lower amount. If it says magnesium glycinate 400 milligrams and then it has a smaller number above that, it's the smaller number that's the elemental number. You need to look at that number. Okay. Jim says at 56, my body has taught me not to run. Well, maybe that's it. Dr. J, how much glycine do we need a day? I mean, in today's modern world, Henry, I think 12 to 15 grams. Lucy says, I walk a lot, but I've been doing 4 rounds of all-out sprints, 10-second only and 2 minutes. Lucy, those are good. So HIIT is different than, because there's more rest. Think of chronic cardio, chronic ultra marathon, chronic 7-mile runs every single day. Totally different than 10 seconds. Increase 10 seconds, a sprint of blood pressure comes right back down the next 10 seconds. But think of chronic elevated blood pressure for 45, 60, 70 minutes every day. It's just different. Okay. So yeah, HIIT is awesome. Sprinting actually decreases fatty liver disease. Sprinting is good for you. Yeah, Tia, large red blood cells, that means they're unhealthy. You have macrocytosis, Tia. Your bone marrow is pumping out very unhealthy blood cells, and that delivers very low hemoglobin and oxygen to your brain and your organs. Your heart is congested because it has no blood flow. It has no oxygen, and it's getting thicker and thicker and thicker to pump blood and to deliver oxygen. So your macrocytosis is a problem. Did anybody look into your macrocytosis? Probably not. Could you have liver failure causing your macrocytosis or liver enzymes being elevated? So you have a liver problem. Do you have cholestasis? What's your bile flow? Tia, your whole thing could have started from metabolics, that you had insulin resistance that caused fatty liver disease, that choked out your liver, that raised your enzymes, that led to congestive heart failure. I mean, that led to poor red blood cells, that led to congestive heart failure. So, you guys, whoa, I didn't even know the time. It is 11:45. We've almost been talking for 3 hours with all of your questions. How about we call it quits and you guys come back? Lord willing, I'll be back tomorrow at 10 a.m. Central. 10 a.m. Central. Saturdays at 9 a.m. Central. Sundays at 10 a.m. Central. Okay. Let's meet back and let's answer all of these questions. Okay. And Jim, just to answer that one last thoughts on consulting a dietitian, Jim, if you don't trust your doctor to give you the correct advice, why would you trust a dietitian? A dietitian goes through the exact same pharmaceutical indoctrination through their curriculum as the doctors do in medical school. So if you want to consult a dietitian, make sure the dietitian is somebody who, I like that little guy. That's a turtle drinking a bunch of stay something. I couldn't read that fast enough. Stay hydrated. Yep, stay hydrated. Um, like, and again, I'm not promoting Dr. Barry, but Dr. Barry trains a class that are good dietitians, okay? They're well trained. They're not trained by the 3-letter agencies that we have now, okay? And yeah, Lucy says you can learn all this here and on other things. You don't need to pay a dietitian, but that's up to you. We are not telling you what to do, but thank you for the super sticker. I appreciate that. Okay. All right. So, Lord willing, I'll be back tomorrow. Bring your questions. We can talk about LDL cholesterol. We can talk about, you can bring your numbers and we can discuss them. We can discuss kidneys and Tia's thing and the vitamin D and all of that. We can discuss it tomorrow. Okay. So, thank you for being here. I appreciate it. It tells me that you want to put time in and learn about your health, because I think that some of the things that we're getting from our own doctors is not accurate, is not enough, and you could do much better. All right. So sorry, Instagrammers, about cutting off 15 times. I think it was only 5, but I apologize for that. If you want to catch the whole thing, go to YouTube. Go to YouTube and catch this whole thing at Iron Lady Doc. And sometimes you have to put Iron Lady Doc Malia Jensen. Okay? Put it all in. It'll take me. Subscribe, hit the like button. And they do this hype things. So if you go to one of my videos, push the thumbs up. And if they say you want to hype this video, HYPE, click yes and click the little thing and give me a whole bunch of points. It's not pay. It just gets me higher on the totem pole. Let's get me higher on the totem pole. Then all of these people will know me. Like that really matters. It doesn't. What matters is I'm helping the Jims and the Stans and the Tias and the Lucys and all of that. It's not about if Paleo knows me or Dr. Barry or Chafee or whoever, Ovadia. It doesn't matter if they know me. What matters is the 1 or 2 people who might gain or glean some information that helps them survive and prosper in life. Okay? All right. You guys have a blessed Saturday. I am going to go watch some softball. See ya. Oops. See ya.